Saldonis, and these are my two colleagues, Marianne George and Paige Rudolph. And we are student-registered nurse anesthetists at Thomas Jefferson University pursuing our Doctor of Nursing Practice degree. We have created this quality improvement project to evaluate the impact of an educational simulation video on anesthesia providers' knowledge of the double gloving technique, as well as your own self-perceived confidence in applying the skill to your own practice. A project like this that regards infection control measures is important for several reasons. Contaminated anesthesia workstations house a large body of microorganisms, where many of these germs have been found to be potential sources for hospital-acquired infections. Hospital-acquired infections are very costly, where they cost hospitals in the United States and over $45 billion annually, and unfortunately result in over 90,000 preventable deaths every year. Therefore, it is the obligation of every single healthcare provider to do their part in preventing hospital-acquired infections, including us as anesthesia providers.
The implications of a contaminated anesthesia workstation range far and wide. The use of gloves have been found to be the main vector of transmission of microorganisms in the anesthesia workstation after the induction of general anesthesia. Research estimates that 17% of surgical acquired infections can be traced back to anesthesia care. For clarity, the anesthesia workstation consists of the anesthesia machine, workstation computer, storage drawers, and countertops. When the double gloving technique is not performed, the most significant area that is contaminated is the anesthesia machine. More specifically, these parts include the APL valve, vaporizers, breathe-in bag, and the breathe-in circuit.
Additionally, the COVID-19 pandemic has emphasized the need for meticulous hand hygiene with the goal to prevent viral or bacterial transmission and contamination of the anesthesia workstation and equipment. The American Association of Nurse Anesthetists, American Society of Anesthesiologists, Society of Healthcare Epidemiology, as well as multiple articles reviewed in the literature, support and recommend the use of double gloving, especially when immediate hand hygiene is impossible during task-dense times. By utilizing the double gloving technique during induction, this prevents cross-contamination of the anesthesia workstation despite the patient's known COVID-19 status. While these multiple national recommendations exist, this does not always translate in clinical practice adherence. In fact, in one observational study, no anesthesia providers were found to perform the double gloving technique during any type of patient care.
Currently, at our clinical site, the hand hygiene guidelines specifically for anesthesia providers state that we should be washing and disinfecting our hand according to the institution hand washing procedure. Our institution's hand washing procedure is the World Health Organization's 5 moments of hand hygiene, which is generally considered a gold standard, which includes performing hand hygiene before touching a patient, before a clean or aseptic procedure, after touching bodily fluids, after touching a patient, and after touching the patient's surroundings. Unfortunately, we all know that the induction of general anesthesia is a task-dense time. And during the entirety of a surgical case, it can be very busy where it's difficult to perform frequent hand hygiene. One study estimated that anesthesia providers have 58 hand hygiene opportunities during a single general anesthetic case. But unfortunately, our busy hands often perform no hand hygiene at all, estimating that our compliance with the World Health Organization's 5 moments of hand hygiene is only 16%. While obtaining 100% compliance is nearly impossible in anesthesia, overall, anesthesia personnel have been found to be the healthcare personnel performing the least amount of hand hygiene. So, with this poor compliance, we can alter our gloving practices during task-dense times, such as induction, to be an alternate method for keeping our hands clean.
Double gloving is a simple solution for anesthesia workstation contamination. The double gloving technique performed during the induction of general anesthesia includes the process of wearing 2 layers of gloves and removal of the outer layer immediately after intubation and before connecting the patient to the breathing circuit or touching other anesthesia workstation components. Several studies have proven the reduction in anesthesia workstation contamination with the use of double gloves. In one study, the group who used a single pair of gloves contaminated an average of 16 sites within the anesthesia workstation compared to the double glove group, who only contaminated an average of 7.6 sites. In another similar study, the single glove group contaminated the workstation at rates 4.1 times higher than the double glove group. Across the literature, double gloving has consistently showed its benefits in reducing cross-contamination of the anesthesia workstation during induction of anesthesia. Despite these benefits, barriers to the double gloving technique exist and need to be better identified for compliance rates to increase.
The current practice barriers to double gloving include time pressure from operating room staff, lack of time to apply an extra set of gloves during task-dense induction, lack of dexterity from 2 sets of gloves, inconvenience, providers being busy, and an overall lack of education in current best practices. However, when providers are continually educated, mindfulness increases, and it has been shown that providers develop a level of comfort, familiarity, and proficient habits to overcome these barriers.
Our goal for this video was to educate you as anesthesia providers on the current gloving recommendations as well as the benefits of double gloving during the induction of general anesthesia. If we make a second pair of gloves readily available, and hopefully we can make this a part of our everyday practice to decrease anesthesia workstation contamination. By now, you should have filled out our pre-survey to assess your knowledge and confidence as it relates to the double gloving technique. You will now watch a scenario of both the single and the double gloving technique as we perform the sequence of events from induction through endotracheal intubation. Before each scenario, we will place a UV light lotion inside the mannequin's mouth to simulate oropharyngeal germs. Then, after each scenario, we will illuminate the anesthesia workstation with an ultraviolet light to assess how we contaminate the surroundings. So, will the double gloving technique prove its worth?
You are now watching a simulated induction of general anesthesia using the single glove technique. Notice how the anesthesia provider's right hand enters the patient's oropharynx, coming in contact with the patient's secretions. The hand comes into contact with the dirty laryngoscope blade prior to touching the breathing circuit, balloon syringe, APL valve, breathing bag, anesthesia machine, as well as the vaporizers. Notice, with the single gloving technique, there is increased contamination found on the OR bed, the breathing circuit, the breathing bag, the APL valve, the anesthesia machine, and the vaporizers.
You are now watching a simulated induction of general anesthesia using the double glove technique. After advancing the endotracheal tube through the patient's vocal cords, the anesthesia provider disposes of her dirty outer layer of gloves and contaminated blade. She will now inflate her pilot balloon, connect the circuit, put the patient on the ventilator, and turn on the anesthetic vaporizer. She will also secure her tube and start anesthesia with her new clean gloves. As you can see, the double gloving technique has significantly less anesthesia workstation contamination, which is consistent with the literature.
Thank you so much for taking the time to watch our educational video. We hope you found it to be informative and motivational in your transition to permanently using the double gloving technique. Deploying this tactic certainly provides for a more conscientious anesthetic as well as improved patient care. If you would all be so kind, please fill out the post-educational video survey that we have provided to you via the link sent to your email. Thank you for your time and for your participation.